All right, it is 4:30. I'll call the special meeting of the City Council to order. As you guys all know, that in the last couple of weeks, the coronavirus, or COVID-19, has become very prevalent in our community. No, wrong words. Not prevalent in our community, but prevalent in our society in the United States, and it's something that we have to definitely address and how we're going to move forward with that. The city's role is for the safety and the well-being of the citizens of International Falls. We have been staying in touch with the World Health Organization, Centers for Disease Control, Minnesota Department of Health, and the Coochin County Department of Health and Human Services. We did have a meeting this morning that involved stakeholders in our community, and this is just a follow-up of what the city is doing and how we're going to be working with the medical services and the County Department of Health moving forward. So we did have a 2 o'clock department head meeting today. With that being said, the City of International Falls will be continuing to offer our services of 911. That's police, fire, and ambulance. We also will be continuing water production. Obviously, we have months of supplies. There should be no interruption for any water services in International Falls. We have no issue continuing to make water. Also, no water is going to be shut off in the city limits of International Falls. If you have water service and your bill is behind, we will not be shutting you off through this pandemic. Public Works is going to continue to run water, sewer, and clean the roads and deal with all of the stuff that you would think that our Public Works Department would be handling. In addition to that, we do have department plans on how we're going to be moving forward in the next couple of weeks through the pandemic. The police department, the building will be closed to the public. They will be screening dispatch calls for phone follow-ups, and we will be moving to minimal staffing. This was outlined earlier today with our department heads. Chief, do you have anything else to add? Is there something that you would like to bring up in the forum? I can bring the mic to you if you'd like.
No, that's fine. No, I think that pretty much covers it. I think the important thing is so everybody just knows that if you call 911, if you got a problem, we're going to be there. We're still going to come. The services will be there. You may see some change in the fact that we may do more things over the telephone when possible to limit our officers' exposure. So, but for the most part, you shouldn't see too much change in our services.
And thank you, Chief. Next, fire and ambulance. The building has been closed to the public for the last couple of days. There has been a sign outside only allowing the emergency service personnel in. With that being said, all of the staff is doing incoming screening process as they get on shift to make sure that they are healthy and safe as they come in. And this one probably isn't the best way to word this, but in the event that we do have some people that do have the coronavirus or do come up positive and we have to do ambulance runs, we are looking at using one ambulance for those runs so we don't have cross-contamination between ambulances. The wording of dirty ambulance probably isn't the right way of doing it. However, I didn't know how else to word that, but we're going to use one ambulance to transport people in the event that we have to do that. Chief, do you have anything to add?
I would just echo what Chief Masson said. As of now, our service is running status quo. If anything changes, we'll try and make that known to the public. If there's any any changes, we'll try and make public, I guess is the best way to word that.
Fair enough. Next, Public Works. Again, we're going to be closing the buildings to the public. But with that being said, just the nature of that department specifically, they are going to continue their business as usual until something changes. Do you have anything to add to that, Director Brokaw? Okay. City Hall. Now this one's going to be a little bit different. City Hall is going to be closed to the public. We have access to paying our bills online. We have access to paying our parking tickets. We have access to paying our water bills. All of that is going to cause us to be able to be closed to the public. We are still going to be fully staffed. So in the event that you do need something, you're welcome to call in to the city office. We're going to be able to work through that. They're going to be available by phone. All of the city council committees have been canceled until we get through this. The city council will be viewed as an essential service. Our meetings will still be open to the public, but we are going to have distancing and space distancing maybe a little bit better than what we have tonight. Does anyone have any questions? Or Administrator Anderson, do you have anything to add to how we're going to operate City Hall?
No, I do want to impress upon everybody the fact that, we want to continue our services as much as possible in the same way that we have as possible. We just feel that this is a prudent decision to try and protect the people that are in the building as well as people that are visiting the building. So as you pointed out, Mayor, paying water bills can be done online. We have payment drop boxes, one on 4th Street where the sidewalk intersects there, one on 3rd Street. And will be available by phone to help walk people through any concerns or issues that they might have. We just want to try and limit the amount of public exposure in both directions.
And the one that doesn't get picked up on this one would be the building official. In the event that you need to get a hold of the building official, again, just give a call. Those numbers are available both online and through the phone book. So and we'll have them posted on the building. So that's how we're going to handle City Hall moving forward. As for the library will be closed to the public, and we're still going to allow the online resources. Obviously, we wouldn't take those away. There's still access to books, movies, anything that you would need on the library. This one is a weird one. We're still trying to figure out if it's going to be staffed in some capacity to be able to work. This is a conversation piece, but as of right now, it's going to be closed to the public. And Cary Park is closed to the public as well. So that's kind of where we're at right now. All of these are just to limit social interaction as outlined by the CDC and the Minnesota Department of Health. I want to thank all of our department heads for coming in and having that conversation with us today so we could kind of try to focus this. I also want to thank both media outlets of KGHS, KSDM, and the Journal. Both of them have been absolutely fantastic of giving out the correct information from reliable resources such as the CDC and the Minnesota Department of Health. So thank you to both of our media sources. In addition to what the City of International Falls is doing, there are a couple of key players in our community as well that have limited access that I want to bring up. I did speak today with Ward Merrill at Bacchus, and Bacchus is canceling all of their events moving forward. I'm not certain on how they are going to continue the community cafe. With the community cafe, they are going to limit it to phone calls and pickups. You would have to contact Bacchus specifically to see how they're doing that, but they do have a plan in place to offer food moving forward. The Senior Citizen Center also has closed to the public, but they are still offering Meals on Wheels. So the drivers are pulling up to the back and they are getting the meals and the addresses and they're just going. The only people that are inside the building are the employees that are making the meals. And also the school district, they've made some really tough choices in the past 48 hours, and I think that they definitely get kudos from the city for making a tough decision to close 2 days before the rest of the state. With that being said, does anybody have any immediate questions for the city before I bring in the medical personnel and the Department of County Health? Anybody have questions on the city? All right. If not, Rob, if you'd like to come up, I would, and your crew. You guys have lots of seats.
Well, I'm going to let my infection preventionist speak to some of the medical stuff we're doing, and then I'll just give them a brief update on
Fantastic.
things. So,
Can you speak into the mic? That would be great.
Sit
You
down.
can even take it.
Okay.
We're going to take this pretty casual.
So the consistent general recommendation right now is to stay home if you're not feeling well, unless you have respiratory problems, you can't breathe, and you should come in. Otherwise, the recommendation is just to stay home and self-quarantine. And of course, continue to wash your hands and practice standard precautions. Good hand hygiene. Don't touch your face. Don't touch railings out in public, things like that. So, yeah, this is from CDC here. To stop the spread of germs, avoid close contact, cover your cough or sneeze with a tissue or a cough into your arm like this. Again, avoid touching your face. Clean and disinfect frequently touched objects and surfaces with bleach. Stay home when you're sick and wash your hands. That's all on here from CDC.
So with that, we're in constant contact with MDH. At least daily, I'm on a call. This is 24/7, even over the weekend. Saturday night, we're on a call with the governor. Sunday, our whole executive team was there putting things in place. Even though we don't have any confirmed cases, we're doing everything. We've restricted all visitors. No visitors are now allowed in the hospital at all. We've canceled all of our elective surgeries and any kind of cases we have starting next week. So that'll cut down on the foot traffic as well. So we've taken this to the extreme measure. The only other thing I think we could do is really we'd look at maybe setting up external triage, and we've got a plan for that. We haven't got to that point yet to pull the trigger on that, but that'll be next. So, and with that, I'll take questions.
I just have one question. What process do you need residents to know in case they are sick, or how should the casual resident handle being sick and accepting service?
So again, unless they're running a high fever or having difficulty breathing, stay home. Because more than likely, that's probably what we would do. If we start to become inundated, we're going to have to triage people. And unless you're having difficulty breathing or high temperature, we're probably going to send you home.
Okay.
So,
Do you want them to call ahead?
we haven't discussed that yet, but we probably should. Do you want to chime in on that?
I would also add that I do think it's a good idea if you are having questions, if you're wondering if you should come in, I think it's a good idea to call your primary care provider. I think at some point we're going to develop some sort of more formal triage process by phone, but I think that's a good idea. Obviously, if you are having difficulty breathing, you come to the emergency room, but we would rather get as many people into the clinic as, and not clog up the emergency room.
And as far as the clinic goes, expecting that we are going to have some residents who do need to come in and be seen, but maybe don't need to go right through to the emergency room. We are moving out any of our well patients. If any of you have a visit scheduled with a clinic provider and it's not for something that's urgent, emergent, or the illness, you will likely be receiving a call from us. We will be scheduling your appointment out further. Those empty slots then are going to be available. And so the first call from the public, unless you are in dire straits and you are having trouble breathing, if you need to be seen by a provider but it's not an emergency room, then you need to call the clinic and we'll make sure to get you in and we'll take care of you. And if we need to triage you for the ED, we can do it from there.
Any other questions?
I do, Mayor. Mr. Pastor, can you just explain a little bit about what external triage might involve?
So today, Adam and I and Roz actually went and looked at one of the trailers. And what we would assume is we would bring one of those trailers into the parking lot. We would have people go through there before coming into the hospital. We would triage from there versus having people come through the clinic or the hospital.
And triage means for the...
Are they sick enough to be treated? Are they somebody that can probably go home? Do they need to go to the ER? Can we send them to our clinic? Really, more or less, just kind of figure out where people need to go. So that'll be the next phase.
Okay. Anyone else have any questions? All right, Dr. Stone, do you have anything to add?
Rob and I talked earlier today. It sounds like we're pretty much participating in the same meetings with Minnesota Department of Health. What we have been doing at Essentia is we basically corridored off part of our clinic, again, asking patients to call ahead if someone really does need to be evaluated and screened for COVID-19. They're coming through essentially a side entrance. We've corridored off our community room as a COVID-19 screening and possible testing site with an external exit. So we are trying to keep the rest of our clinic functioning on a normal basis. We have good capacity right now. We realize that this is obviously a big deal, but people are still getting sick in other ways that need to be evaluated, so we're trying to continue that. We are offering a free of any copay e-visit service as well through our organization, where people can do an online visit for external triage as well, with recommendations for home care and whether or not they should actually come into a local site for testing. But otherwise, very much as the folks at Rainy Lake saying, we're trying to convince people that if they're well, then they should stay home or relatively well, they should stay home and self-treat unless things are getting worse and they feel that they're in the need where they need more medical care. As far as our services, really, we've been, Department of Health has suggested we don't do some nebulized therapies. We have some workarounds for that, just the event someone had COVID-19, that we wouldn't be further spreading the virus throughout our facility. But otherwise, we're trying to move forward and really operating the clinic with two sides, COVID and the non-COVID side is kind of our approach right now.
Okay, so that e-services, is that just available on essentialhealth.com, or what is the website
so our patients have access through our electronic med source through MyHealth. They could go on to the web to essentialhealth.org and obtain an e-visit that way as well. And normally there's a copay for that. That copay is being waived during this time. So.
Okay.
And then those calls will be handled by physician or nurse practitioner. They may not be handled locally. It kind of goes through a pool. It could be answered by any essential health provider who's on the service in the state. So.
Okay. Well, thank you. Does anyone have any questions for Dr. Stone? Ken.
Mayor, and for either of the healthcare providers, I'm just wondering about the availability of test kits if there's some suspicion that somebody might be positive for COVID-19.
We have actually done very few tests at this point at our clinic, and our supply right now is quite good. We use the same test kits for other things like flu and other viral assays. So the COVID-19 uses the same test kit. I believe today, I think I counted about 120 available test kits, and I think that's sufficient for our needs right now.
Rob, do you want to add anything to that?
Because ours is actually changing a little bit.
Okay.
The one thing I want people to know, the community, is that you can't just come to the hospital and demand to be tested. There's still certain criteria. We had people calling saying they wanted to be tested. We're actually switching now through Quest Diagnostics through Stanford, so the turnaround time will be 3 to 5 days. Prolonged testing times are due to the amount of testing that's being performed from all over the region. So again, that's why we don't want everybody to be tested. There's certain criteria that may change. On the call the other night, they were saying that there could be a 4-hour test that's coming, but we haven't seen that yet. And the doctor's order is still required for either test. Some of those tests will go to Stanford, some will still go to the state lab. I believe if you're a healthcare employee or an inpatient and we suspect it, it has to go to the state lab for tracking purposes. So, any questions about that?
If I can echo what Rob said,
sure.
Yes, we're kind of advertising or posting our services as COVID screening. We're not listing as COVID testing. None of the patients I saw today in our COVID screening clinic qualified for testing. So we certainly don't want people feeling if you walk through the door, you're going to be tested. You have to meet criteria. Otherwise, we will exhaust those tests very quickly.
All right, thank you. Anybody else have any questions for the medical providers? Okay, if not, at this time I'd like to bring in the County Health and Human Services, if you'd like to come on up. So basically, just if you could just give an outline of where we're at and how we've gotten to this point, and just give a quick briefing, and then we'll ask the questions that we have on this.
Okay, we've been meeting with having regular meetings with our emergency management group and other partners. We have another meeting set up for Thursday with a much broader group, including healthcare, schools, all the cities within the county, just to make sure everybody's on the same page with the response to this. We've been taking all of our guidance and all of our verbiage from the Minnesota Department of Health. They want consistent messaging coming out from everywhere, so they want us to go with their messaging. We're following all their recommendations. The county has taken steps today to put into place. I could let Kathy tell a little more about that. But yeah, it's
So I guess, what precautions has the city's missed, or is there anything that we need to expand on from what our plan is moving forward?
From what I can see, I think the plan is looking sound going forward. You know, after our meeting this morning that we had discussing different things, it seems like you guys have a very good plan in place. And obviously this is an ever-evolving situation. It's going to change on a day-to-day basis, so different things will be taking place. I know that the governor is having a press conference at 5 o'clock, so I'm willing to bet that there's going to be even more developments coming from that. So
if the state doesn't make the decision to close restaurants and some of those other businesses, is the city would the city consider doing that? Or do you have the authority to do that? I'm just curious.
And I don't know if I have the authority to do that, but that's something we would definitely have to look at. It is my assumption that it's going to happen. I don't know if, I'm new at this too.
Yeah, we're all learning.
Okay,
Minneapolis did this afternoon. Mayor Jacob Craig closed everything. So I would go ahead and assume that we would have that power, but we'll see what the governor says at 5 o'clock. I would assume.
And as far as the rest of the services that we provide over at the county, we are going to be closed to the public effective tomorrow. We have talked a lot about the services that we have to provide and what is not essential services. We'll be focusing, of course, on the essential services. We will still be taking applications for health care, SNAP benefits, all of those kinds of things. We do have a system set up where we're going to have a drop basket for people to drop off applications or pick up applications if they need them, but all contact with staff will be by phone or via email. We do have, I do expect some, right now, all but one employee is going to be in the office, but I do expect over the next several days that we may have some other people that need to self-quarantine for various reasons, and we'll have to look at staffing and whatnot for that. But I think we have everything covered, and I think we'll be able to continue without any disruptions. So.
Does anyone else have any questions for the county Health and Human Services? Ken?
Mayor, I would just ask the question, and maybe an open-ended one. It might be appropriate for somebody from the Public Health Department to just talk about why these measures are necessary or advisable for Koochiching County when we don't have any confirmed diagnoses yet. I just think that might be helpful public information if you could share why that makes sense and why that's prudent from a public health and safety standpoint. Okay, social distancing, community mitigation has been proven time and again. We've seen it in other countries. In fact, the flu pandemic, the Spanish flu in 1918, was remediated by social distancing and community mitigation. It was a big part of stopping the spread of that. It's an inconvenience for everybody, yes, but it is essential in, you've probably all have heard this a million times, lowering the curve. Or our hospitals and clinics can only handle so much at one time, and if we have a big spike in people needing critical care, people aren't going to receive the critical care that they need. But if we can distance socially and spread this out instead of it happening over a 1-month period, spread it out over a 2 or 3 month period, it will make a big difference in the capacity of our healthcare system and the health of our community as a whole. And to follow up, isn't it also true, though, that people can be positive with COVID-19 but not be symptomatic?
Yes,
and
that is
for a
true.
period of time.
That is
So-
true. And I think that, in the beginning, there was a lot of talk from people that, oh, well, I'm not worried about it. I'm young, I'm healthy. I don't care if I get it, but you have to be thinking about everybody else. We may have parents, grandparents, anyone over 60 is at higher risk, and then you start factoring in some other health conditions, and the risk only becomes higher. So I think, Joe, I heard you say, it'll either be, we overreacted and nothing happened, or we should have done more. And you said, I'd rather be the, we overreacted. But really, and I'm not sure that overreacted would be what I would want to say, but if we do take all of these precautions and we're proactive right from the beginning, there may not be any cases of death or severe sickness in our community, and that's what we really want. We want people to be protected and not have people be sick or die because, we just said, it's International Falls. That's not going to happen here, because it does.
Well, and to follow up, one of the things that came out of the 9 o'clock meeting that I thought was very interesting, I believe it was John Decker that had said it. So in 5 months, we looked back and we took all these precautions, and we did all this and we didn't have any fatalities or anything. Did we do too much? No, we did what we were supposed to do.
Exactly.
So I think that everything we're talking about tonight is just a precautionary measure and doing the right things for our community to make sure that our more vulnerable adults and residents are safe throughout the course of this.
One more thing I'd like to mention is that we will be having a Facebook page developed as soon as we can get it developed. That will have Derek will be putting the information about MDH and CDC and anything else on there so that people have a place to go to get information and get accurate, good, consistent information. So hopefully that'll be up and going very soon here.
Okay. Anybody else have any questions for
Just a question about the food shelf.
Oh, the food shelf will remain open. The signs that we've posted on our doors say that it's closed to the public, but the food shelf is open their regular hours. We've already had lots of calls about the food, accessing the food shelf. We've also had calls about whether we're going to be open tomorrow and those kinds of things. So we've answered those the best we could, and we'll just go from there.
Sounds good. Thank you. So does anyone have anything else they'd like to bring up at this meeting? If not, this is basically just an informational meeting that we wanted to have to show the community that we are coming at this as a united front from both the city, the county, our medical services. We're all in this together, and we're trying to pull together for our community. So with that being said, I have nothing else to add. I do again want to thank Rainy Lake Medical Center, Essentia Health, the Department of County Health and Human Services, both media outlets that we get on a consistent basis, KGHS, KSDM, and the Journal. I want to thank all of our department heads for coming in today, having that meeting, coming back tonight, and everything that we're trying to do to make sure that our community is safe through this. And with that being said, we have nothing else, so we can adjourn and go and listen to the governor now.